The punishment phase of the trial of Tanner Horner resumed in Tarrant County today to a degree. The jury was not there today. The former FedEx driver has pled guilty to the murder of 7-year-old Athena Strand, but the court is currently vetting the defense's expert witnesses they want to call to decide if they're qualified to testify later on this week. Amelia McGavro, I know you watched it all in court today for us. What is the takeaway from what you saw today?
Yeah, Doug, today was really the first look at the defense's case. We heard from 4 medical experts today. All of them have evaluated Tanner Horner in the past and all pointed to serious health issues they say he's had since childhood. The witnesses included a psychologist, 2 environmental toxin experts, and a pediatrician. Their diagnoses include autism, fetal alcohol spectrum disorder, and extreme childhood lead poisoning. One doctor even saying Horner had levels of lead that were 24 times higher than average. They also pointed to signs of major head trauma earlier in his life. The psychologist, in fact, also elaborated on Horner's alter ego known as Zero, as we've heard from the previous proceedings, and said it seemed more like an imaginary friend he used to express emotions he couldn't communicate. But prosecutors, they pushed back through all of this, challenging the devices and testing methods used by those doctors and questioning whether the results were reliable enough to be presented to a jury. Ultimately, though, all the witnesses will be able to take the stand if the defense calls on them.
Any other moments that stood out to you today besides that?
Yeah, if I were to pinpoint a moment, I would say it's the psychologist's testimony that really stood out to me. She said Horner claimed he kidnapped Athena because he was, quote, concerned Athena saw him using cocaine. That's an explanation we hadn't heard before in this trial, really. But the psychologist made one thing clear, Doug. In her opinion, Horner knows right from wrong and said this is not an insanity defense.